11. Okay, so it's already, we have ICD-11, but it's not full-fledged. Okay, so ICD-9, the code structure was totally different. You can see the difference. There's no alphanumeric combination. It was very simple and it was not as specific as ICD-10-CM. ICD-10-CM, we have more specific codes. For each thing, we have a specific code. Now you can see, as I told, as the digit change, what happens? The meaning or the condition or the organism keeps changing. So 0, J20.0 and J20.1, all these look similar, acute bronchitis, but it is due to mycoplasma, streptococcus, parainfluenza, it keeps changing. Okay, so digits matter. Now, so everything is the same. And we have this unspecified. Okay, if in the record it is mentioned as acute bronchitis, okay, and there is no mention of any organism, at that time you will pick unspecified. In real time, usually you will not pick unspecified at all, because most of the doctors are asked to give the utmost specificity. Okay, so in Qatar, we were earlier not following much of the specificity. Usually every doctor was going with the unspecified code, but that is actually incorrect. In if we say the ethical way of submitting a claim, unspecified should never be your primary diagnosis. Okay, yes, we are using it, we have to make a practice, because that's the area where coding knowledge matters. We can go in and say unspecified should not be used. Maybe now the insurance are not much strict about it, because even the insurance are used to this way here in Qatar. But if you go to US and if you find something unspecified as principal diagnosis, claim gets rejected. That's it. Will not be moved ahead. There should be specificity. But here it is just, we are not looking much in deep. But make sure we are giving utmost specificity. When there is no specificity, usually we query doctors. We ask doctors, can you specify? Again, if the doctor is not able to specify, then you can give unspecified. Okay. So that is how the practice is. Now you can see, what is this? It is a fracture code. All the fracture code starts with S. Okay. And again, coming to ICD-10-CM, you will be able to understand each code lies, or each code starts with which letter. Okay, mostly all of the cardiovascular, cerebrovascular. Okay, cerebrovascular code starts with I. Most of the fracture code starts with S. Any other examples you know who are already into the field? What is Z code? Status. Status codes are known as Z codes. Okay. Patient underwent appendectomy a year back. Okay. Or years back, appendectomy. So you want to mention a status that the patient is not having appendix or underwent appendectomy. So you want to mention that, you will give Z codes. WX codes. What are W? These are external cause codes. A patient was walking, tripped and fell and had an injury. Injured, got fractured. Okay, so knee fracture. Knee fracture will be your PDX. That starts with S. Then you have how did the fracture happen? Because he tripped. Okay, he tripped and had a fracture. So that tripping also needs to be mentioned, because it might be tripped, slipped, anything. From the chair, from one level to the another level, can be any. So we have to give the more specificity, like how this happened. Okay, then how this happened, we'll be denoting with W or X codes. These are external causes. So tripping also have a code, how he fell. Okay, so all those, that is why I called The ICD-10-CM will give you in-depth, complete understanding of what actually happened with the patient. Okay, so you know that the basic understanding here is insurances will not cover, most of the insurances will not cover accidents. Okay, especially we take insurances for accidental coverage. You already know this, right? Yes. We cannot hear you. Yes, injury on duty or accidental. For example, I'm a horse rider. Okay, let it be. I'm a horse rider, and I usually practice or I do horse riding. And I did horse riding, and I fell off. I had a fracture. So if we go to insurance company with the normal insurance that I have, it will be clearly mentioned. For example, QLM, Alkut and all, they'll be mentioning all the accidental coverage which is voluntarily done, okay, will not be covered. That means he knows that there is a chance of falling down if I ride a horse and you are a sports person. Okay, so you will be having another insurance for coverage of that might be there. But if you don't have taken, your regular insurance will not cover. They will say sports is a risky area. You know that it will, for you, the chances of injury is there. Then you wantedly did it and you fall down. Will not cover. This is the idea. Okay. So this is how things are. So that's the reason they mention how the injury happened. If it is accidental, if it is voluntarily happened, or if it is something else in the hospital, he fell down. So in hospital, if he fell, it is another condition that we are not using here much. Hack conditions are there. Okay, those are much deep. We don't have to go much into that area. Okay, hospital acquired conditions will be there. Okay, hack conditions. Okay. Now coming to this one, displaced intra-articular fracture. So this is again initial encounter for closed fracture. This A, you can see A here. So this A denotes initial encounter. That is with the fracture, he is coming to the hospital for the first time. Okay, this is his first visit. There is also S. You can see, okay, subsequent, you know, you have subsequent, you have after effects, sequel A. Okay, there are three codes. Instead of A, there will be different letters, which denotes if it is second visit or after the follow-up visit, or it is a sequel A, that he fell 3 months back and now he is coming. That is after that fall, he is having some injury now. So sequel A. Okay, all those codes will be there that we will be learning. Now, coming to hematopoietic and immune. Yes. Hmm. Like I didn't get it. Hmm. Hmm. No, no. That's why I told the sequencing will be based on the guideline. Okay. Each chapter in ICD-10-CM, let it be ICD-10-CM or CPT, you will be having guidelines, which is very important that we'll be learning next. That's why I'm hurrying up you through this anatomy physiology, because this is not something that you will not be able to do it by yourself. You will be able to do it. But ICD-10-CM guide, understanding of guideline, coding, picking the codes, CPT, another very major area where the weightage is high is CPT. So in CPT, you will have to pick each system wise. The codes are more complicated there. How the surgeries, you will have to understand what is the surgery, how is it performed, what is the approach, what is the root operation. So those are very complicated areas. So that's why I'm running through this. Okay. If you learn those areas there, you will be able to understand more. So here, as you told, fall, injury and all those injury, you are coding something medical related. You are not letting them know that he fell, or that is not your key point. Your key point is code the diagnosis, code the working procedure or whatever service is rendered to the patient. So what is the diagnosis? There is injury. So injury will be your key PDX, or fracture will be your PDX. Secondary followed by that you're giving additional information about the fracture. Fall, whatever it is. Where also, where did he fall? Was it in house or something? There again you have subdivision, X series codes you have. Or someone is coming with a injury with having after the bomb blast. You have a code. After bomb blast is what the patient had this injury. So you will be having something like injury, or you see something pricked or something went inside, you know. Those codes will be coded as first, then you will be having the bomb blast that happened as X series code. Okay, those are additional information. Never, those external codes should never be principal diagnosis. Okay, clear? Yes. It will be different. It is, the coding will be basically first principal diagnosis followed by SDX, secondary diagnosis. Secondary diagnosis can be 1, 2 or n numbers. Okay. Secondary diagnosis can be based on what currently he's coming with or with history. Okay. History of the patient had cardiac arrest or something like histories are there. He's asthmatic patient. You want to denote, because asthmatic, a patient who is asthmatic and coming with some other condition, the person who is giving medication, the person who is treating him should be aware that so and so cautions should be taken for this patient because asthmatic, it is a chronic condition. So asthmatic condition, so asthmatic patient, you have another CPT code for asthma. No. Z codes can be principal based on encounter. Z codes are, there are also codes which is like encounter. Now patient is a cancerous patient. Patient is coming for chemotherapy. Okay, now patient is coming purely for chemotherapy. Already known that patient is having cancer. The guideline says that you'll be learning all these guidelines. The guideline says that patient, if he is coming only for chemotherapy, chemotherapy intervention or encounter should be PDX. So Z code. Encounter for chemotherapy, we have a code. So in that case, Z can be PDX. PDX. Okay, so it is based on encounter. Another one, patient is coming, a lady is coming, not sure about if pregnant or not, coming for the first time to check if pregnant. So it's coming for supervision of pregnancy. That is coming for the first time. So you will not be giving any other diagnosis code. You can give, there is no conditions, okay, other than coming to check that if pregnant or not. Other than that, the patient is not having any other conditions, not giddiness, nothing is there. So in that condition, what you will give? Supervision for pregnancy, you have a Z code. So you'll give that code because patient is coming for that to know if pregnant or not. Yes. Okay. Okay. Two code in the sense, which two codes? Yes, but as secondary, it should not be primary. What is the reason for encounter? Why the patient is coming? Why the patient is coming? Again? Any? Just follow up. Just follow up. Another thing is follow-ups will not be covered until the given follow-up period. Okay, so if it is follow-up, there is again a code for follow-up that you can give, but follow-up codes or scenarios will usually be not coming because it doesn't get covered. Okay. And follow-up, you're billing follow-up and it is getting covered. After surgery, it is routine follow-up, right? You have routine follow-up code. You can give that, but it is not covered. Okay, by if you take in case of insurances, usually You know, for Alkut it is 14 days. For QLM it is 7 days. Until that period, if the patient is coming as follow-up, it will not be covered. But we can code it as follow-up, routine follow-up code. Okay? Internal? Internal billing. Yes. Yes, that is what. Routine follow-up, we can give code. Z code is there. Okay?
So basically, there is the simple alphanumeric codes which is covered already under diagnosis, diagnosis and the treatment.
Yes.
Here there is another one that will cover the diagnosis, the treatment, and the reason.
Yes. So, what?
Then there's another one that will cover the diagnosis, the treatment, the reason, and maybe the number of times.
Yes.
This is coming the first time, the second time, that time.
Yes.
So is it a combined code or they have to be different codes?
No. See, all these codes, the treatment, you have totally different code. That is CPT. For diagnosis, you have totally different code. That is ICD-10-CM. The picking of the diagnosis depends upon coming for the initial and time or secondary sequelae follow-up, what it is. As I told, S-series code, there is different codes. If it is follow-up for the fracture, you have a different code, but only one code. That is a
single encounter might have few.
For example,
Somebody got a fracture.
okay. Okay, give me the scenario. Yes.
So got a fracture. Be
Okay.
So the code will start with the S.
Yes.
Right?
Yes.
And then they will say it's a fracture. There's
Yes.
a code for that, right?
Yes.
And then
that is what the S series code is. The first one, fracture code. Okay.
Fracture.
Then
so the treatment will be there.
that is CPT.
Okay. So not in the
Not ICD-10-CM. Okay, now I'm discussing only about ICD-10-CM that I have been talking. I have showed examples only for ICD-10. Yes, multiple. So multiple diagnosis. You can code all the diagnosis based on severity will be your PDX. So if you have fracture, yes, all are because he fell and he's coming for the first time, right? So it will, yes. Now it is again based on the severity. How you will define a patient is coming, okay, he is having left knee fracture, he is having right elbow bruise, okay. Then how will you code? Bruise is what? Something external. It's on the skin. What you have here is fracture. It is to the bone level. Again, based on severity, based on anatomical type, anatomical site. This you will learn in the diagnosis of injury. Okay. ICD-10-CM in the injury chapter, you will be able to understand which is maximum severity, which is the lower severity. Based on severity, you will be coding. You will be coding both because it's two different sites. One is knee, one is elbow. So you'll be coding both. But the PDX, principal diagnosis, will be defined by your severity. Yes. In depth. How depth it is, the injury is how depth the injury is. Based on that, you will be assigning the PDX. Okay, this you. Yes. Yes, yes, yes. No, 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 no. That is another area. Yes, no, no, no. They'll not tell you how to do it. Yes. So you need to understand what is what for. Okay, that is why we are going through this course. If diagnosis, whenever diagnosis comes, you have to go with ICD-10-CM. Whenever treatment comes, X-rays come. In the last class, this is why I discussed all these points. That's the reason you will be not knowing. So I have discussed about radiology. I have discussed about anesthesia. I have labs. Then we have surgeries. All these codes are CPT. Okay. Then what we have is HCPCS, medical supplies. Patient coming via ambulance using the hospital supply, that is ambulance. Yes, it is HCPCS. Okay. So we have Three different categories where you will have to analyze. When we learn, you will understand. In the book, there nowhere it will be in the question paper. It will not be mentioned. Please pick it from the CPT or ICD-10 CM book. They might say what is the correct diagnosis. So you should know diagnosis CM book. What is the procedure? Please code for this procedure. Then you should be able to understand it is from the CPT. Yes. We'll be discussing sample questions, and also we'll be giving you practice question. Yes, yes. You can again go through. I will give you that. I think you have gone through that recording, isn't it? So you can just go through thoroughly on that. And I think you don't have that split which I gave you. Some of you noted down, I believe, weightage. You noted it down, right? Did I share it in the group? It was not shared. Okay, okay. Terminologies are shared. You can refer there. And this thing I will share it because for those who didn't come, okay, I missed it. Weightage will be shared. Okay, what is it? Hmm. Hmm. Yes. Yes, the scenario based question cases will be 10. Okay, the rest will be sticking on to one. It will be circulating, or it will be only one diagnosis or one procedure that they'll be asking. Scenarios will be very less. This will be to the straightforward. They'll be mentioning this is what the procedure is. Okay, the explanation of the procedure or the portion of OT notes, you can see some of the descriptions that will be given. That portion will be given to you where you will be able to identify it is only from the procedure that they are asking the question. And also same way for diagnosis, you will be able to understand from the question it is only diagnosis question they are asking. Okay, a lengthy scenarios will be only 10 questions. Okay, there you might be wondering, there you will be have to pick the ICD-10 CM, CPT, everything together, club together, you will have to able to understand. Even in the scenarios, they might ask only the CPT or only the CM. It is based on the question. So when we learn the patterns, you will be able to, when we discuss, practice questions, you'll be able to understand. Okay. Before that, when we go through the book, because still now you haven't gone through the book, that is the reason you are little bit confused. When you once you see the book, the guidelines, and once you are thorough with the guidelines, it will be easy. Okay, now coming to blood composition. Blood is composed of okay, RBC, platelets, WBCs are the very important components of blood. Okay, so shall I give you a break? Then we'll rush through. I thought of finishing even the endocrine system today, but too many questions on the first class. But that's okay because yeah, it's because you don't have an understanding on how it is going. And I believe all of you will be attending the next session as well. So since few of you couldn't attend the last session, there were too many queries, I believe. So if you have anything, even if you go through the recordings, you will be able to understand. If you are having anything, what we can do is in the next class, tomorrow's class, as I come, we can discuss all the questions. Then once we move on to the topics, we'll just fast forward the anatomy because it's, it is somewhere it is a vague topic. It keeps on going. If we discuss, it keeps on going. But the major area for us is ICD-10 CM and CPT, which is very important. HIC picks, it's easily, we can crack it. It's not a big deal. Okay, then we'll have to discuss the billing points, regulations, fraud and abuse in, claim submission and all those. Those area is also very small, and the repeated questions will be discussed where you can claim. It is compliance and regulatory. There we have another weightage. So as I told, I will put it now. Okay. It's under? No, 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 no. It's not under those. Okay. So you can take a break and be back. Okay. Only one day.
But for the succeeding weeks, it
Okay, so they have started already. They have started releasing. They have started procuring people. Which one? That is what I have been discussing now. The same thing. Okay, mandatory health insurance will be there. Every person will need. You went to MOPH, that training last 2 weeks back, which we had. Okay, fine. So that is what it is. So now coming on to blood. So what is the function of blood? Transport food, gases, and waste and hormones. Even hormones are transported through blood. Okay. So we have WBC, RBC. This is thrombocytes are. Yes, plate. What is that? Yes, it's platelets. Okay. And we have plasma. So what is the, so if you see blood components, eosinophil, neutrophil, these are the components. If you take a blood smear, okay, what is blood smear? Sample. Yes, sample. Yeah, blood smear. If you are in lab, so you will be knowing. So blood smear, if you take, you will be able to see in the microscope all these things: eosinophil, neutrophil, basophil, RBC. So what are these? Usually cells. Okay, monocytes, platelet. So this is how a blood smear looks like under a microscope. Okay. So what is granulocyte? What is granulocyte? Yeah, granule form. So it is based on all the components that we are defining. So we have neutrophils, how much percentage of neutrophil. So you will, when you do a CBC, what is CBC?